Hi, everyone. Thank you for joining us today and welcome to our monthly session of opportunities in HIT, Health Information Technology. My name is Melissa and I am the president of the HIT Student Association here at St. John's River State College in St. Augustine. We are pleased to partner with Northeast Florida Health Information Management Association to offer these monthly lunch and learn sessions featuring health IT and health information management professionals. A few points to cover before we start. Everyone in the call is muted, so if you have any questions for our speaker, please feel free to drop it in the chat box. And everyone, one CEU will be granted for your attendance today, and information to claim that credit will be available at the end of our presentation. And the last point of the session, and the last point, the session is, of course, recorded. So without further ado, I would like to introduce our guest speaker. Her name is Ms. Kelly Fass. Ms. Fass serves as the Program Director of the Health Information Management Program at Missouri Western State University. Ms. Fass, we appreciate you sharing your story with us today. And at this point, I'd like to turn it over to you.
Thank you so much, Melissa. I'm so grateful to Dr. Bantes and to your school and your regional for asking me to be here today. Awesome. I am a person who says a lot. I haven't had the good fortune that Dr. Bantes has had yet to go to Toastmasters and figure out how to get rid of that. But I'll be doing that one of these days. I heard someone in HIT the other day speak that I really admire, and they said too a little bit, so kind of made me feel a little bit better. But I will get my presentation slides going here. As I was introduced, I am the program director of the HIM program at Missouri Western. I also am the advocacy director for the Missouri Health Information Management Association. I just got off of a call recently, or just within about an hour ago, with the AHIMA Component State Association Advocacy Subgroup, and they're putting together something for the states for advocacy. So I'm very passionate about that. I believe that being involved in decisions and having a voice is to be valued and treasured. And so I'm a cheerleader for our association being able to do that. I'm also the director of education for a regional, similar to the regional that's sponsoring the education today. I've worked in HIM, mostly HIM, for 43 years. And I turned 60 this year, and I asked one of my very good friends, how in the world did that happen? But I've had a lot of experience, and I'm going to tell you just a little bit about that as time allows, of course. I have been working in HIM education for 10 years. I was a classmate of Dr. Bantes at St. Scholastica, and that's how we got acquainted and became educators within a few years of each other. And so it's been a great relationship, being able to talk to not only her, but other classmates that we had at St. Scholastica, and even the professors that we had have been great colleagues too. So I started out with a bachelor's in business administration, and I didn't get that right away after high school. It was about 20 years. I tell people I was on the 20-year plan. I took courses through our community college, just general education courses, and then didn't think that I would eventually use an HIM degree, and it wasn't actually available to me in the area that I lived in, and that was before the time of online education. So I did complete a bachelor's degree. At the time I was a business owner, and I'll tell you a little bit about that too. But I did graduate then with the graduate degree about 10 years after I completed the degree in business administration. One of my professors at my program at Quincy University said to me, "You're going to be back getting a master's degree. I just know you will." And I told her she was crazy. But there I was, signing myself up to complete a graduate degree of AHIM. I also got a certificate of health information exchange at the same time. And recently I completed the AHIMA Cancer Registry Management course through AHIMA. So I've got a couple of more certifications that I'm going to be working on. I'll tell you a little bit about that. So as you'll see from my story, I ended up in a situation where I needed to have the RHIA credential. So that's what led me back to St. Scholastica and back to school. And so I did complete that in 2012, and I'm looking at some other credentials as well. I've prepared myself to take the CHDA, and I'm looking for the opportunity to do the practicum hours so I can also sit for the CTR. So I've been 43 years in this industry, but I'm not really sure where my pathway is going to lead me. I feel like it's important to continue to be a lifelong learner. And so who knows what the future might bring for me yet. I'm going to be working for a while. And one of the things that I want everyone to take away from our time today is that always have goals. Always make some type of goal for yourself. And goals can be changing. They aren't static. They can evolve over time. And actually, it's best if they do. And always be learning. Take the opportunity to learn. And you'll find out in my story why that is critical. So I started in 1979 when I was still in high school. My mother was a medical transcriptionist, and she approached me right before the summertime, before my senior year, and said, if you could work where I work, would you be interested in that? And I was going to need gas money, and I thought that would be great, and it interested me. So I interviewed and ended up going to work where she worked. I worked there, and then I had several other positions as well. It's an interesting story. All those years working, I worked at the clinic for about 2 years where she worked. And, that was such an interesting time because we were just on the cusp of technology. We were using a Selectric typewriter. We didn't even have correction mechanism on the typewriter. We used a lot of whiteout and cringed every time we had to do anything. Our x-ray reports were on like a triplicate copy that you had to correct not only the front page, but you had to correct all the pages behind it. I can remember if a patient came back in, we had to find that particular dictation on the blue belt, dictaphone blue belt. It was a little belt that fit on the machine, and the recording of the physician's voice was on there. And so we're transcribing, and you'd get a phone call and they'd say, "We need patient John Smith for an appointment. They're coming in an hour." So then you'd have to find that on that blue belt, transcribe it, and then we put it on a lift. So we were in a 4-story building, and the lift was over in medical records, and we could take the chart then over and put it on the lift. And it was a wooden box that was in like a shaft, not an elevator shaft, obviously, but a small shaft that went up and down in the building. We'd put that in that wooden box, and then we'd go call the nurse to let her know that it was there. And that was our interoperability in those days. It was just a really interesting time. We did have a key punch machine where if patients had a pap smear, then we had this normal pap smear letter that we had. Well, to keep us from having to type each and every one of those letters, we had a key punch machine that letter was stored on, and our boss could print out multiple copies of it, and then all we had to do was insert the patient name and address on it. There wasn't any such thing as HIPAA. Now, we protected patient confidentiality, and if you didn't, you no longer had a job. But it was just a very, very different time. And then I had the opportunity to go transcribe at the hospital, which was great. It just keeps going. So in my whole career, I have been a physician office manager. I owned a medical transcription service. I became a manager of HIM, and then I became an educator. And so you can see I'm building skill all the way through here. That's been my entire career, is what can I learn next? So as I said, I was a medical transcriptionist, and I described a little bit about that. And why they hired me was because I could type fast. I had taken typing in school. And then I also knew a little bit about medical language. And you're thinking, well, you're in high school, and that was a long time ago. So how did that happen? Well, we had a biology teacher. His name was Rodney Higgins, and he was a very good teacher, but he had a lot of expectations. And we had to actually memorize Greek and Latin prefixes and suffixes. And then every Friday we'd have a quiz of about 15 of those. And it wasn't multiple choice, or it was all fill in the blank. And so he would give you a term, and then you had to say what it meant. And I found that really fascinating, because all of this was part of language that you use every day. And it became this really interesting thing to me to be able to sort of decode words that way. And so I really listened to that and learned as I was going through my biology courses early in high school. And boy, did that come in handy, because that was a fast-paced environment. I described a little bit about what it was like. The doctors had very high expectations of quality. And so, to remember words, we just had a dictionary. Even back when I first started, we didn't have specialty word dictionaries. All we had was our Dorland's dictionary and a reference for pharmaceuticals. That is all we had. And so we indexed words. I had a notebook that when I heard a new word, that word got written down in that notebook. And that's how it helped me remember what the word was. And our supervisor was great too, because she had an expectation of us taking on new work. And so the increasing difficulty of work was another thing that I'm glad that I let myself over to, because I was able to learn tremendous amount of all the specialties: cardiology, radiology, dermatology, otolaryngology, just tremendous amounts of information that I was able to get from those 2 years of working. So then I ended up at the hospital, and there I was transcribing history and physicals and operative notes and discharge summaries and consultations. And I had to work nights in order to get my job, but it's what I wanted to do. So I did that. And I have the crazy hair person here, because Dr. Shi, he was an OBGYN, and he would come into the hospital at night to deliver babies. And it was so crazy because, during the day, he was like this fella in the suit, and he always had his hair was just, just perfect. And when you come in at night, his hair would be like sticking up straight on his head. And it was quite interesting. I always imagined the moms, expecting him to walk in his suit and look all, all dapper and nice. And here he's coming in, just right out of bed. But, it was a great time, and the technology was changing. It was changing so quickly. We weren't using a dictaphone blue belt anymore. We had tapes in a tank, and the doctors would dictate, and the tapes would pop up out of the tank, and then you put them in your transcriber and transcribe them. Little did we know that. So that's what it was at that time. But now there's a whole new career path of scribing, where you actually go into the room with a physician, or there's even video scribes that do that through an internet connection, and help the doctor document what's happening with the patient. So then, we're continuing to have these regulatory changes, and I ended up at a physician's office transcribing for them. And then I had the opportunity to manage their office, like everything. And that was really a great time. I spent a lot of years there. I really enjoyed working for the physician, and electronic health records came while I was there. And it was the coolest thing. So, Medicare came knocking on the physician's door and said, well, you're not going to be able to send your bills to us anymore unless you make them electronic. So he was a private practice physician. And so, yeah, he got an electronic health record, and it was fascinating. I helped him every year with all of the updates for revenue cycle, because, new codes would come, and I would help him figure out what new services he could provide, and how we could pay for an Abbott analyzer in his laboratory. Just all kinds of really cool things I was able to do there. And one day he came to me and he said, well, I've been doing a little bit of programming on Thursday afternoons, because he didn't see patients on Thursday afternoons. And so he said, we're going to hang around on Thursday afternoons, and we're going to write this program for colonoscopies. And so what we're going to do is we're going to tell the computer that we want to know every time a patient comes in that is at an age where they should have a colonoscopy. And then every time that a colonoscopy is performed on a patient, we're going to enter in whether they had polyps and what kind of polyps they were. And then we're going to let the computer tell us in the next 30 days, these are patients that need a colonoscopy exam, either for surveillance or for follow-up. And we did that. And it was fascinating because, what do we call that today? Clinical decision support, right? And it was really cool that he and I were able to write this code that helped generate a report like that. And that was also the time that now voice is not being put into a tape anymore. It's being recorded as a WAV file, and you can send the information back and forth. And there was a company in Chicago that was kind of courting me about, you want to take some tapes and do them at night. And we're working on this new process where, eventually we'll be able to send this, to you over a phone connection. And I decided to do that, and they kept wanting me to take more and more work. Well, I had a network. So network's important. I had a network of people who were transcriptionists, because I belonged to an association that was for transcriptionists. And so I started calling them up, you want to take some tapes? And they were like, sure. And so this business started, the medical transcription service that I had, Fast Transcription Incorporated. And so here I am. Eventually, that had more financial future for me than working at the physician's office. So that was my next step. And so, yeah, so we're doing the medical transcription service, and the technology just explodes. No longer are we, having to send a disc back with the information on it. We're actually able to get into the patient record through a virtual private network and type directly into the record. And I tell you, during this time, it was an amazing time too, because my husband and I were exposed to all of this software that was brand new. And so we spent a lot of our Saturdays driving to St. Louis. So at that time I lived in Quincy, Illinois, which is in West Central Illinois. And so we would drive to St. Louis and buy whatever manual we needed for whatever new software was coming next week at XYZ client. And we would spend our time figuring out how to use things and how to do things. And it just continued to grow and grow and grow. And the demand was enormous at that time for medical transcription. And during that time, we also dealt with HIPAA. HIPAA came to be, and then we had to provide new ways of educating people and making sure that we were compliant with the requirements of the new regulations. And then what happened in 2009, the American Recovery and Reinvestment Act, this incentivized physicians to now digitize their electronic health record. And that was a big timeout for me, because at the beginning of 2009, we had 50 people working remotely in my company. And by the end of 2009, I had 8 people still working. So I'm sure that Dr. Bantes remembers that particular time. And I'm sure she can relate to many of the things that I'm talking about. But
so many, yes.
So I had to figure out, what was I going to do? I wasn't ready to retire. I hadn't gotten wealthy doing what I was doing, because we were very good to the people who helped us produce all of this work. And so I decided that I would get my master's degree and go to work at the local hospital. So that was my next step. So I went back to school and got my master's degree. And during that time, I was working in an HIM department at a hospital. And that was another, just learned so much working there, and learned a lot about coding, a lot about encoders. One particular thing that happened there, the state of Missouri had an RSS feed, and we would monitor it, but all of a sudden somebody brings me this paper, and it says that the state of Missouri has found an error that is occurring, and your quality department has reported half as many vaginal hysterectomies for last month than you should have. What is going on? And so began this whole process of trying to figure out what had happened. Well, we had an update in our 3M, and we learned from another hospital in our state that update in 3M was causing the codes for that particular procedure to be mixed up if the patient also had an oophorectomy. And so all of these reports were not correct. And it really was interesting trying to problem solve, and HIM directors do this every day. There is some kind of puzzle that they have to figure out how are we going to figure out this workflow, or how are we going to accommodate some kind of change that's coming. So it's fast paced, but it's also great because you're affecting change in your facility that helps your patients. I always tell people, we don't touch patients, but we touch the patient's data like no one else in healthcare. And human information, health information is human information. And I think this working at the hospital was like a full circle for me, because I saw all of these things come together. And but I wasn't teaching. I wasn't teaching anymore. In my transcription service, that's one of the things that I was very involved with. And I had like this model that I developed where I'd bring people in and they had never transcribed before in their life. And I had this process where I would teach them and they would learn. And I really missed that. I mean, we had 18 people in our HIM department, and they all knew their jobs really well. The only time that we had to change anything was if we got a new process or that kind of thing, but I wasn't actively involved in this teaching process all the time. And I realized that I really missed that. I talked to a mentor. Mentors are critical too. Mentors are sort of your guide. They can really help you figure out, this is my goal, but I think maybe my goal is changing. And so I'm going to go talk to my mentor and bounce some ideas off of them, or maybe they have a connection that I can go talk to somebody. So that's kind of what I did. And I figured out that this was going to be another bend in the road. And another thing that I want to mention, during the time of when I realized that the medical transcription service was sort of had run a full cycle, that particular technology was causing this sort of full cycle phenomenon, that I had to find a lot of gratitude, because that was a really hard time to try to figure out my place and what was I going to do. And I'll tell you that keeping a gratitude journal was one of the things that really helped me visualize what was going to happen in my professional career for the future. And so, you know, I went and I talked to my mentor, and she said, you need to be teaching. So another kind of crazy story. I went to Assembly on Education, which is the national convention for HIM educators. And I took my resume and I put it up on the bulletin board. And so I get a call from a text from my husband. He's at the venue with me, but he's just along for the trip. And he says, I met this guy, you got to meet him. His name's Gary, and he's here and he's looking for a program director. And he said, I told him about you and he wants to meet you. And so we're he met this fellow. So my husband would go to the little tiki bar there at the hotel every day. So we always say that my job in education came from my husband having coffee at a tiki bar with Gary. And so my husband came to meet me after the day's session, and we're walking to go to dinner, and here's Gary walking towards us. He goes, hey, there he is, there's that guy. And so before I knew it, the next morning I was interviewing with the dean of the college, and 30 days later I was starting a new job. So you know, those connections, and then being willing to step out of your comfort zone and go and do things that maybe haven't been exactly what you envisioned your pathway, or, you know, you never know when you're going to be in a place where you can have this experience but you have to get out there. And one of my mentors, one of her big things is you got to show up. You know, you got to get dressed and you got to go and you got to show up. So I'm really glad that that was something that I did that day, and I was there. I worked in an associate program for a couple of years, and then we had a grandbaby that was born back where we had lived before. And I ended up at Missouri Western because it cut my commute to see my little grandson in half. And so ended up at Missouri Western, and there I am. I'm working in a AHIM accredited program. We just got word that our program was accepted for our APAR report, which is an assessment report that happens every year, and we'll have accreditation for another year. So I'm really proud of the work that I have done there. I started there as an assistant professor, and I've been promoted since then to associate professor and the program director. So I want to talk about my role a little bit, because I am sure that in our midst is an educator. I'm confident of that. I'm very passionate about HIM education. I believe our work is so important. And so what I do in my job every day, I am responsible for everything that happens with our program. I work with our other full-time faculty, and she's located in Albuquerque, New Mexico. So we're both remote, and we take care of everything that happens. All of the professional connections that we have there in that local area happen through her and I, even though we are remote. And what I've been working on the last 2 years primarily, and Dr. Bantes can relate to this as well, CAHIM and AHIMA update their curriculum every few years. And so new curriculum was to be implemented by September of this year. And that has been one of my primary areas of work, making sure that we have met all of our domains and competencies in what we are teaching our students. I have to have excellent communication skills. You know, when you're working remotely, to be able to convey your meaning in a way that's precise and concise is very important. People don't want to read long emails. They want to know what they need to know, but they don't want a lot of repetitive or additional information. So I always go back to my English teacher who in my English 2 course, I got very frustrated because it seemed like I could not please that professor to save my life. And they said something very profound to me. They said, "You're a good writer, but you could be a better writer." And so, you know, we're all at a different stage of writing, correct? Writing development is something that just continues and continues. So I have to remind myself that a lot and make sure that I'm not putting more into an email than what is necessary. I work with our department and with our university. We do some interdepartmental, interdisciplinary things. We had students that actually went to help with vaccination clinics, which was really interesting. So, you know, we talk about how data is so important and how the structure of our data, you know, it's kind of garbage in, garbage out. Well, learning how databases work is critical in our field. And I'll tell you, I'll give you a really great example of why that is. So when the forms were created to submit the verification of vaccination for each patient that came through, instead of having a constraint for St. Joseph as the word written out, which is how the state of Missouri identifies it, they allowed people to put in Saint, ST period, Joseph into that particular data field. Well, what do you think happened? Half of those immunizations were not recorded by the state of Missouri in that county because of that data constraint not being present in that form. Now, that is critical. So if you have an opportunity to learn about databases in your program, make sure that that is something that you have some focus on. So I also oversee all of our professional practice experience. Now we have a coordinator who does all of the scheduling for those, but I work on all of the contractual agreements. I make sure that our assessments are appropriate and equitable, especially in my own classes. I do the program review. I orient and mentor the faculty, and of course, figure out how to have our course offerings so that it fits into the university's schedule. We're looking at going to 8-week courses. I don't know if that's going to happen, but our RN to BSN program recently did that within the last year, and I think we could replicate that. I also advise students, so I'm doing what Dr. Bantes does in the process of helping you figure out what classes you need to take next. And then we have a focus in our program on diversity and inclusion. It's very important. Our program is an open enrollment program. So anyone who comes into the university, we don't have any qualification for students to be in the program. So we want to make sure that we're serving all of the students that are eligible for our program in the same way. We have a student site that all students have access to. And so that's a little bit about what I do. I do have a lot of autonomy. So some of these things that you're going to see here may look familiar because I think Dr. Bantes used some of them in her presentation as well. But I really love being able to have some autonomy over my day. and be able to schedule things during the day. Like where I am now, there's a lot of opportunity for exercise, and I'm a lot healthier here because I can get out and do that. Whereas where I lived before, it was much more, there wasn't nearly as much opportunity. And it's also just the most amazing thing to see our students out in practice and thriving. And yes, our work is so important. Yeah, and so of course there are challenges. You know, we do have an open enrollment institution, and that's a little bit different than a private institution. Sometimes the private institutions can be a little more, they might have some entrance requirements that students have to meet before they come into a program. And you know, HIM is different than other disciplines in higher ed. It just is. We are an applied type of career path. And sometimes that doesn't translate well to other career fields that maybe aren't. And we don't have a doctorate education as a terminal degree. So, you know, in promotion and tenure, for example, people who look at our material have to look at it a little bit differently than someone who, where there is that particular field has a specific doctorate. Now, you can pursue a doctorate in another field, and a lot of people do, and your professor has done that. But for our specific field, there isn't. And, you know, I think in the general public, what does HIM do? That also is, you know, you see in media and on TV programs, you see a lot of physicians and nurses, but there's never anybody who's HIM who's actually very visible. And you have to make sure, if you're working in a remote environment, that you don't become sort of this out of sight, out of mind type of thing. And you know, there is continual change, but that's also a strength because we're constantly learning, and that is of tremendous value to us as professionals. So my recommendations for pursuing a career: yes, you have to be willing to be there and be present, and always be open to new opportunities. I think of the opportunities, if, you know, I had arrived at 2009 and decided, oh, I'm just going to go do something else, the wonderful, wonderful opportunities that I would not have been able to have, that I have been. It, you know, always be learning, always make it a value proposition to you. And then, you know, maybe it's not a value proposition like for you immediately right then, but learning is always a value. And advance your education, keep building on what you have. And I am seeing opportunities now that I may want to pursue with certification. And I may want to do that. I miss the clinical environment. I really do. And maybe I can eventually have sort of something that I do on the side that's more in the clinical realm. Know what your personal strengths are. If you have the opportunity to do that within your education, do that. If you don't, go out and see if you can do a strength finder and find out what makes you, what are the things that help you contribute in a work environment. Have perseverance. That's one of my strengths. And be inspired. Absolutely, absolutely. And you know, always have that humbleness too. And if there are people who are that you can glean information out of in a room, take advantage of that. Ask them questions. And take time. That's one of the reasons why I'm where I'm at now, is so that I can take time to get out and enjoy the wonderful environment that we live in, and volunteer. And those are wonderful opportunities to network. Social media, you saw that I'm on social media. You know, when we got email, I was really upset. I was like, I just want to deal with the mailbox. I don't want to deal with reading email too. And look where we are now. It's amazing. Publish and speak. Yeah. the opportunity to share what you know and what you have are fantastic. Ask for the seat at the table. If you can contribute, say, hey, I saw this, or I saw a webinar on this, and I want to contribute. And then again, focus on gratitude. So I have a few resources here, and I think that I'm going to leave this up. And I think Dr. Bantes will probably give you these slides. And a big thank you to Dr. Bantes for the presentation format. And I should have probably cited her on a bunch of that. One of the things that I was going to show you, but I think we're running out of time because I want to make sure we have plenty of time for questions. So if you haven't been on AHIMA's Career Map yet, go there. It's wonderful. It's a great resource. You can look at all of the different jobs that are available, the ones that are emerging positions because of technology, and then go out on Indeed and look for those jobs, see where they are, and then do the salary snapshot down at the bottom. Your certification will bring you tremendous financial reward. And so, that's a great goal to have. And it can help you just be able to become a professional, blossom in your role, and then find new opportunities. So I am going to open the floor now for any questions that anyone might have.
First, I just want to say thank you. What a fun trip down memory lane your journey was for me personally. I mean, that was just exceptional. So thank you. And I also want to put in the chat here for those who want to receive CEU credit and don't necessarily have questions, shoot me an email. So Charlene Banta at sjrstate.edu. And I will get that back to you by email probably tomorrow. I usually try to do it the next day. So with that, I see we do have a question in the chat already. Why did you decide to pursue the tumor registry certification now as opposed to earlier in your career? I ask because I'd like to specialize in one of these types of registries.
That is an awesome question, and I'll tell you why. So in my role, my previous role in the HIM program at Missouri Western, I was the PPE coordinator. And so one of the opportunities that our students had that they could do additional, what we call our professional additional hours, was to go to a cancer registry training that is held at North Kansas City with a tumor registrar there. Her name is Luann Currents. And she teamed up with the Missouri Cancer Association and offered this training. And so we made it available to our students. And I went to that, and it just really fascinated me. And I thought, I kind of wanted to pursue that. And so I did. And it's also part of my promotion and tenure. If I seek additional certifications, that's another point that I can get. So, and like I said, I really do miss being in the clinical environment. I always, when I was transcribing, I never became a pathology transcriptionist, but I had the opportunity, of course, to read a lot of pathology reports, trying to figure out what a doctor was saying. I just always found, and that's probably a little bit of my biology, high school biology coming through, because we also had to do really intense labs for Mr. Higgins, and identifying cells, and that all just really interested me. I also, when I worked at the hospital, I had the opportunity to, our cancer registrar had to, she had a family thing that she had to go away, and in our tumor committee meeting was that same day that she had to be gone. So I got to go to that committee meeting. And I found that really, really interesting too, because you got to hear about these cases that, they had at the hospital and the different treatments, and hear the physicians actually talk about what was going on. And we, one of the hospitals in Missouri, the University of Missouri Hospital, some of the oncologists there were using the phone to connect with us and talk to those physicians as well. And I just always found it really interesting. And it's, it's through that data that's collected that we're figuring out how to create better outcomes and find treatments that are more effective. And I just really find that interesting. Great question.
Yeah, it is a super interesting field with a lot of opportunity. I'm not sure if I've ever shared with you, you mentioned the CHDA being another of the certifications that you were possibly preparing for. I've sat for that one. Did I tell you this?
No.
And being completely transparent, I failed it. So the CHDA is super heavy on statistics. So for anyone else on the call who's considering kind of supplemental certifications and you're really strong in statistics, that's a highly valued one. Statistics is not my strength, so I had no desire to try to prepare to take that over again, just because I have to recognize my weaknesses. But any other questions?
I've learned a lot more about statistics because I'm teaching our clinical data management, and we do a lot of activities around statistical analysis and figuring out through statistical packages, what's more likely, less likely to happen types of calculations. And I've gotten a lot more exposure to that just from teaching it. So I think I'm going to give it a whirl. We'll see. I've heard it's really, it's one of the more challenging ones.
It is a tough exam. As you were sharing your story, so many of your memories resonated with me, from making corrections on the typewriter. My early days at Mayo, we had that typewriter. We had to put the little white correction tape in to make the corrections. In the pre-HIPAA days, I took a break when my children were younger for about 5 years, and during that 5-year span, HIPAA came into play. And when I came back to work, it was a whole new world. So it's been a journey to see the evolution over the years, for sure. So another question, do you think it's easier now with the technology that we have?
Oh, that's a really awesome question. Let's see. More efficient? Absolutely. Because if you think about how, doing a chart audit, for example, back in the day before we had the opportunity to run a report, just, stacks and stacks of charts. And I remember even physicians coming into the hospital to sign various reports, sign off on their operative report or their discharge summary, and just the tremendous amount of effort that it took to gather all of them, to have them in a place where the physicians would have access to them, and then the physicians coming in to do all of those. None of that was easy. It was not easy at all. So, there's kind of two sides to that too. I think, I think some of, and this comes from my perspective, but I don't think that it's exclusive to me, because I think if you look at, if you go Google physician burnout and electronic health record, do those in quotes and the other one in quotes. And I think you'll find a lot of information about how physicians feel somewhat put upon that they're now the documenter, that that's not happening in some other way. And then they also feel like, I think sometimes, that the information that they want placed in that record about their patient, there's not a place for it, not like they used to be able to just, write it. They might have to do a click box that maybe doesn't represent what they want. Or, you hear stories about physicians also kind of gaming the system. Have you heard the story about the physician that installed an electronic health record in his office, and he was just wanted to meet the meaningful use requirements, and instead of choosing the correct identity of his patients according to their nationality, instead of going all the way to the bottom of the list, he just made them all Albanians, and you think about that in a clinical environment, of the physicians they don't want more work. They're trying to keep people alive, I also compare it to, when I go to the grocery store, I want everything in a place where, I hate going to a new grocery store because nothing's where I'm used to it, where it's been. And then I can't be as efficient as I want to be. Well, that's what a physician feels like, when they have a new workflow that comes along. And I'm sure Dr. Banta, in her role now, where she's trying to help create efficiencies and help the physicians a lot at Mayo, they're trying to keep people alive. They're not just going to the grocery store, so, I think that there's a lot of things that we need to optimize with the electronic health record. Certainly interoperability is a big part of the equation. I think it's going to be really interesting to watch the next 20 years to see what happens next. It's really going to be, and we need innovators. We need people who have a fresh way of looking at things. And we need people who understand the work that we do. There was a really interesting study that's been done recently about a particular career field that's kind of paralleling ours. And when you go and you look at job descriptions for that particular career field, it's a completely new career field, population health management. If you go and you look at that and you look at the skills that are required, there are things that HIM has been doing all along. A lot of it is. And so, technology is fantastic, but the core of what health information management has always provided in the care of the patient is still the same. It's just that the things that we do are different to arrive at this. And there is a lot of efficiency, tremendous efficiency created by the electronic health record. And those are all wonderful things, and ways that we can evaluate things that we haven't ever been able to before. Look at what we're going to be able to do with a longitudinal health record. People are going to have an electronic health record from the time they're born until they die. And we can look at that body of data, and we've never been able to do that. So, I didn't really answer that, but I think I gave you a little bit of how I feel about that particular,
Yeah, I think that was an excellent explanation and super insightful. So I love your grocery store analogy. I would say that many providers not only feel like they're in a different grocery store, but there are only self-checkout lines, right? It's like they have to do it all themselves, and they feel like they have a lot of clerical burden that they didn't have formerly. And another key word that really resonated with me that you said was optimization. So I think that the future, we've implemented electronic health records. We have automated a lot of processes. Now it's all about optimization. It's about creating systems that truly add value to the practice. And I think that's the road ahead, at least for the foreseeable future. So Katie would like to know where you would say there are more opportunities to expand in the HIM, HIT field?
You know, that's a really awesome question. And I really tend to go to Indeed. You know, I go to Indeed and I try to look at, you know, what's there. So not all of our students, but a great deal of our students live in the St. Joseph, Missouri area, the school where I teach. And so I monitor that quite often. And there are tremendous opportunities in data analysis right now. That is something that there just are a lot of jobs in that particular area. Medical coding. And yes, we are automating some of the processes of medical coding when you talk about more very specific disease processes, or very general, or you know, where there isn't much complication to what's going on. You know, some of that's being automated, but there's always going to be someone who is going to have to evaluate whether that data is valid. And there's always going to have to be someone who understands that process in a very intimate way, so that when new regulation comes, that they can look at that regulation and then take it to their organization and say, in order to optimize our payment, now, you know, within what is appropriate, I'm not talking about upcoding here, but to take that knowledge that they have of revenue cycle and how services are paid for and the regulation, and be able to translate that down into, this is what our physicians need to do in order for us to document what happened to this in this patient encounter. That knowledge is HIM. That is what we do. That is what we have always done. And that is not going to go away. There's always going to be a patient encounter. There's always going to be a physician that's documenting what's happening in that encounter. And there's always going to be a payer on the other end. And so, you know, I think medical coding, get into that field and then become a validator, become an auditor, become the person who's working in compliance, that is going to be able to tell your organization, this is the steps, these are the steps that we need to do with this new regulation. So, you know, those are our two huge areas, I think. And I think registries are going to continue. You know, there's not just cancer registry, there's trauma registry. There's now disease registries, like for diabetes, for cerebrovascular accidents, for acute myocardial infarction. You know, we want to gather data about these patients so that researchers can look at it and figure out how to make our care better, how to make our patients survive these events that happen, and then how to continue to care for that patient throughout the length of their disease. So registries is another big area that I feel like is really going to be continue to be a very viable job opportunity.
Yeah, another one, if I could add, that I've just personally noticed a lot of openings recently, is the clinical documentation improvement professional. That not only is a really interesting area to be in, specifically if you have a good coding background, but there's a lot of room for professional growth, and can be a lucrative field to be in.
Yeah, and of course, information technology too.
Sure. Yeah.
You know, that's, I noticed before I got on the call, there's a hospital in West Virginia that's offering opportunities in their IT for a 13-week sort of apprenticeship type of internship. Excuse me. And those were really interesting. You know, project managers was one. Process analyst was another. It looked very interesting.
Any other questions?
Oh, I love your comment, Melissa. That's great. Thank you very much. Thank you. I would not trade my career. I think there's only one other career I might trade for it, but it has to do with a hobby of mine. You know, if I could do my hobby for my whole life, then that would be terrific. But you know, I'm really grateful. Have a lot of gratefulness that my mom came to me that day and said, you know, do you think you'd want to do this? And that I had paid attention in school and learned the things that I needed to learn to be able to be successful at learning what I did, and then continued to make a choice, a conscious choice to learn every opportunity that I could get. And it is true. It is true. There are many opportunities out there. But you have to show up and you have to be present, and that's important. That's one of the most important things. And stepping outside of your comfort zone. You know, if you're not a person who speaks to other people easily, you know, I used to be a very more reserved and more shy type of person, I guess. And social situations with new people was not my strong point. And I just kept exposing myself to the opportunities to reach out to other people. Interested people are interesting.
Mm-hmm.
So, you know, strike up, learn your elevator speech, you know, learn about where you see yourself going, about your goals. Be able to verbalize that, practice it with your family or with a friend, and then go put yourself in professional situations where you can engage with people, and make it a goal that maybe you just engage with one person. You know, I always used to do that when I would go to conventions and various events like that. It's like, if I brought back one thing that I could apply to my work environment, then to me that was successful. If I made a connection with one new person, or if I talked to, if I made a connection on LinkedIn with one new person, or if I talked to 5 new people, I was always putting myself in that situation to be able to do that. And it's sometimes not comfortable. It just isn't, especially if you're a person that it's not natural for. And all of us, it's kind of like that writing development thing that I talked to, you know, when you have those things that you can develop further, then think about them and think of ways that you can apply that to your life, where it gets more part of your habits, I guess.
Well, again, thank you so much. So many golden nuggets of wisdom you've jam-packed into this last hour. So beneficial for our students and our guests who joined us today. Remember that we do host these each month. It's the first Wednesday, the first Wednesday of the month at 5 p.m. So join us for our December session when we'll be back here at the same time. Have a great evening. Thank you.
Bye, everyone.